Every week it's going up. So we started 4 weeks ago. I think we had 1 patient in the ICU with COVID, and now we have 14.
And increasing by?
Probably 4 or 5 patients per week in the ICU, and certainly far more up on the ward. So this corridor down here is all of the COVID patients. Each one of these rooms has 2 people in it, and you can just walk in now.
Code blue, CT.
That whole console there is the ECMO machine.
And so what's that doing for that patient?
So it's basically taking over the entire function of his lung. So there's a catheter the size of a garden hose in his neck, and there's a catheter the size of a garden hose in his groin. And basically it takes the blood out of his groin, puts it in the machine, takes the carbon dioxide out, puts the oxygen in, and then pumps it back into his heart. And so basically completely takes away the function of his lung and does it for him.
That's lung failure from COVID.
From COVID.
So these are 2 COVID patients on life support.
On advanced life support, both are unvaccinated, and both are on the highest level of life support you can get anywhere. If you get sick with COVID and you get really sick, it doesn't matter how young you are, it doesn't matter how healthy you are, you could very well end up here. And once you end up here, your chances of survival are limited. It's frustration with the individual choice that the patient made. It's anger with the social context that got them to make that decision. It's anger with people posting on social media that COVID's not real or that vaccines don't work. That basically preys on vulnerable people who are trustworthy and forces them to make bad decisions that in some cases are lethal. And we see that here. And so this young man was totally healthy. It's very scary.
That's okay.
I don't even think we're at the crest of the 4th wave. I think the wave is building. So I think it's going to get worse.
I think he's kind of sort of pre-fractured like that. Okay. Yeah.
Right? I mean, I do.